Hello, in this session we are going to talk about how to approach a lump short case. This short case is a very common short case and almost anyone can get this for the examination. For the study purpose we have the examination order. Then we use a mnemonic for that. It is the SPACEPIT. For our study purpose and for our easiness, we split this mnemonic into three parts. The first part is vivas. There are side, size, shape, skin and surface in that part. Second part is PACE, P-A-C-E, plane, attachment, consistency and edge. The third part is the P. For that we have pulsatility, inflammatory changes and transillumination. The first part, vivas. There are side, size, shape, skin and surface. For the side, you have to describe the exact anatomical location of the lump. And for the size, usually you have to measure it in centimeters. You can carry a measuring tape or ruler for that. For the shape, you have to describe the overall form of the lump. As example, whether it has a hemispherical shape or irregular shape. You have to describe the skin of the lump, whether about the skin integrity, whether there is scarring or ulceration, whether there is a punctum, whether there are color changes in the skin of the lump. For the surface, you have to describe whether the surface is smooth or irregular or nodular. For the second part, PACE, we have to describe plane, attachment, consistency and edge. For the plane part, you have to describe whether the lump is in superficial plane, subcutaneous plane or deep plane. And for the attachment, you have to describe whether the lump is attached to skin, to muscle, to underlying structures. For the consistency part, you have to tell whether the lump is soft, firm or hard. For the soft part, the consistency is same as the lip. The firm part, the consistency is same as the nose. For the hard, it is consistency same as the forehead. For the edge of the lump, you have to describe whether the lump has well-defined edges or irregular edges. The third part is the P. That we are going to talk about the pulsatility, inflammatory changes and transillumination. For the pulsatility, you have to describe whether the lump has expansile pulsation or transmitted pulsation. For the second part, inflammatory changes, you have to check whether there is warmth, redness, tenderness or swelling in the lump. And for the transillumination, you have to check whether the light passes through the lump. So this is main three parts of the lump examination. Okay. Thank you.